Hello my friends, hello, welcome to my channel. In today's video we will be talking about intermittent fasting, and I've got my show notes here so I don't miss anything. If you have been following me on Instagram, you know that I have been talking lately about the benefits of intermittent fasting and how we can use that for weight loss. So today we'll talk about what intermittent fasting is, and then we'll talk about what you should be eating and what schedule may work for you and how you need to exercise. So first of all, what is intermittent fasting? It's not starvation, it's simply a schedule of eating. You alternate periods of not eating with periods of eating, and that's it. It's simply a schedule. That said, there are several benefits of fasting that you may want to think about. Number one, especially for those of us in menopause, we know that our estrogen levels are dropping. Because of that decline in estrogen, we are becoming insulin resistant as time goes along. So that tells you that when you fast, of course, you're not consuming any calories, and so you are driving down that insulin level and makes it so much easier for your bodies to release fat. And so women in menopause, you want to consider intermittent fasting, especially if you are having such a hard time with weight loss. You want to think about it. Another thing that we want to know during intermittent fasting, there are other hormones that change. Another one is the human growth hormone. No, you're not going to go taller, but that's one of the hormones that helps us with our metabolism, and it also helps us with muscle mass. So if you've been listening to me, I've talked about how that decline in estrogen will make your body lose muscle mass. And so intermittent fasting will increase your human growth hormone levels and help you with muscle mass maintenance and help you maintain your basal metabolic rate. So those are the two main ones. The second thing that happens with intermittent fasting, because we are now eating during a restricted time period, and we'll talk about the different schedules, so all of a sudden it makes it so much easier for you to meal prep, because then you're eating only during this restricted time, and it would also decrease your potential for snacking. We've talked about trying not to snack as a way to decrease that caloric intake. So intermittent fasting is just one of those good schedules to try to learn and to try to apply to self, because it would help you if you are struggling. So what is intermittent fasting, or how do we go about it? There's different schedules that you want to think about. One of the biggest things to know is that it takes your body about 12 hours to use all the energy that you have consumed during meals. And so if you fast 12 hours or longer, that's when the greatest benefit for weight loss comes into play. So the schedules are simply fasting for 12 hours and eating during a 12-hour window. That's one schedule. There's another schedule where you fast for 14 hours and eat during a 10-hour window. Next one is fasting for 16 hours and eating during an 8-hour window, or fasting for 20 hours and eating during a 4-hour window, or fasting all day long and eating just one meal a day. That's the OMAD diet, one meal a day, or eating in restricted calories for 5 days a week, and then you have 2 days with a few more calories. All right, now the schedule that you pick should be one that works for you. So just think about whether you are beginning, or you have already done fasting, or you want to restart. I always recommend that you start slow and build up. Why? Because we don't know how our bodies are going to respond to it. If you want to do anything long-term successfully, last thing you need is to start struggling right off the bat. So I always recommend to start slow. Try to fast for 12 hours if you're just beginning. And how do you do that? Build it around your own schedule. There's no one schedule that fits for every single person. I recommend that you build it around the times that you are sleeping, because it's great to fast when you're sleeping. Okay, so if you come home, let's say 7 o'clock or 6 o'clock, and you have your last meal at 7 p.m. or 8 p.m., that's when your fasting starts. So you can start fasting from 8 p.m. If you wake up in the morning at 4 or 5 or 6, don't eat anything until 8 a.m. the next day. So you have fasted for 12 hours, and so on and so forth. Build your fasting schedule around the time that you are sleeping. However, for weight loss though, there are well-documented studies that show that fasting for 16 hours is beneficial. So again, if you're just starting off, try fasting for 12 hours, 2-3 days a week, and see how that goes. If you did well, then you can stretch and fast for 14 hours for the next week, 3-4 days. And if you did well, then go ahead and fast for 16 hours, 3-4 days. You notice I said 3-4 days. Why is that? It's so hard to fast consistently, long term, every single day for months and months and months and months. We don't do that. We don't want to do that. In addition to that, after about 3-4 weeks of doing the same things, of fasting for too long, now your body starts adapting to whatever you're giving it, and pretty soon it's not losing any weight. All right, so you want to at least give yourself a short break in between. During those breaks though, you want to still stay on ballpark healthy meals at least 80% of the time. So fast for 4 or 5 days, but not every single day for months and months and months. So let's say you build up to 16 hours of fasting, and now you're eating in an 8-hour window. I get a question all the time: how many meals should I eat? Should I eat 2 meals? Should I eat 3 meals? Should I eat 1 meal? I don't know. There's no one fact, or there's no one number of meals that fits everybody. The one thing that you must remember, your body will lose weight when it is in a caloric deficit. See, that's the mistake I made when I started intermittent fasting. I just felt just because I was fasting, my body was going to shed the weight. No, you have to be in a caloric deficit even when you are fasting. So let's say you're supposed to consume 2,000 calories to be in your caloric deficit. You need to stay in that same number of calories when you are fasting. Fasting alone doesn't make you lose weight. It depends on how much you are eating and what you are eating, even when you are fasting. So let's say I now picked the 16-8 schedule. I'm fasting for 16 hours and I'm eating during an 8-hour window, and I choose to eat 3 times. What should I be eating and how much should I be eating? This is when we go to the internet. You can pull up any caloric deficit and use it, or just use this very simple, easy formula that takes your weight in pounds and multiplies by 13. That's just an estimate, and you need to consume that number of calories during your eating window. All right, what should we be eating? Those of us in menopause, we know those estrogen levels are decreasing, and muscle mass is declining, basal metabolic rate is declining. So I've talked often about how you need to continue to consume proteins. You must consume proteins even when you are fasting. You really need to be mindful about how much protein you're consuming. The formula for that one is 1 pound, so 1 gram of protein per pound of body weight. Unless or except you are over 170 pounds, then you want to go with your ideal weight. So for example, if I weigh 180 pounds, that's just an example, and my ideal weight is 140 pounds, I need to consume 140 pounds of protein per day, even when I am fasting. All right, experience tells me, this is just my personal experience, it's awfully hard for me to consume this number of protein in 2 meals or just 1 meal. That's just me. You've got to try it to see what works for you. But me personally, in an 8-hour window, I try to eat 3 to 4 times because I want to keep up with my protein consumption even when I am intermittent fasting. That's for protein. Very important. I tell my patients and my clients, put the protein on your plate first, then add healthy carbohydrates and add healthy fats. We need to be eating in all food groups. But you must remember, intermittent fasting alone will not make you lose weight unless you are in a caloric deficit. I hope this makes sense. This is the key, being in a caloric deficit. All right. The next thing you want to think about is, what do I consume when I am fasting? So fasting doesn't mean starvation. We need to hydrate ourselves during the time that we are fasting. And I have received all kinds of questions about what can I consume when I am fasting. So number one, you need to consume water, lots of water, lots of water. I personally, I try to get in a gallon per day. You don't have to do that if that's just not you, but the CDC recommends for females to consume 2.7 liters of water per day. If you don't have any medical conditions that prevent you from consuming that much water. For men, the amount is 3.7 liters of water per day. So we need to be drinking water. Find you a good quality green tea. You can consume that as well, unsweetened. You can drink unsweetened coffee and unsweetened tea. That's what I recommend. All right, some people add lemon to their water. I always say if you add any calories to your water during intermittent fasting, it breaks your fast. Some people say it doesn't, some people say it does. For me, personally, I don't want to take any chances. I just consume the unsweetened beverages. Other people consume carbonated drinks that are not sweetened, carbonated water and things like that. I do know though that carbonation and makes us have more cravings later on in the day. So I personally, I avoid it. But I always say, you do you. Figure out what works for you. The carbonation, if it's just plain carbonated water, try it. If it works for you, go ahead. There's no one size that fits all. But that's all you need to be consuming when you are fasting. That said, there are a group of people who should not be fasting. I always say, anytime you hear some advice on the internet, on a live like this, please speak with your medical care provider so they can advise you if this will work for you. All right, some people are taking medicines like insulin for diabetics and other diabetic medicines. You may not be the ideal candidate for intermittent fasting. Why is that? You're taking insulin, all of a sudden you're fasting for 16 hours, blood sugars can drop dangerously. Other people who should not be fasting are women trying to conceive. All right, for me, I'm past the age of 54, heading to 55. I'm not trying to have any babies, so yeah, I can fast as much as I want. But if you're trying to conceive, or trying to have a baby, or if you're pregnant, or if you're breastfeeding, intermittent fasting is not for you. All right, other people have eating disorders, anorexic or bulimic. If you have an eating disorder, intermittent fasting may not be for you. So consider all those things. For the rest of us, try it. If you're struggling with weight loss, especially if you're a female in menopause, you want to try intermittent fasting. It may give you that little break you off that cycle where you're not losing, kind of stuck in the same place, things are not changing. Try intermittent fasting. It may help you. The next question that I get though is, when it comes to exercise, how do we exercise now that we are fasting? All right, there's a few things to think about. If you are doing cardio, and I'm going to tell you what works for me. If I'm going to do cardio, so walking or jogging and things like that, I prefer to do that in a fasted state. Why is that? Because I'm doing simply cardio and I have fasted for about 16 hours. My body has no choice but to go to the reserve, so fat, borrow that energy and use it while I am doing cardio. All I'm doing is just walking or jogging and that's it. Now, if I'm going to the gym to pick up some serious weights, to build some muscle, There's a couple of things that I do. If it's early in the morning, I am still going to consume my fast, but I do want to consume some proteins within the first hour. So generally, I'll eat something like, I don't know, some scrambled eggs within the first hour after exercising, or I'll take a protein shake because I know that after I've done some weightlifting or some resistance exercises, I have broken down my muscles just a little bit, and I don't want them to stay in that condition. I want to replenish them. So I'll be consuming some protein, something with protein after exercise. Now, if I'm really going to push it up, amp up my weightlifting, say, this is the day that I said I'm going to increase my weight from say 20 pounds to 30 pounds today, I will probably want to exercise in a non-fasted state, meaning that I'll probably go to the gym in the evening after I've consumed my meals and I've got some energy to pick up the weights and do my exercises effectively. At the end of the day, there are two things that count when it comes to intermittent fasting. You want to pick a schedule that works for you and for your schedule. It doesn't matter what time of the day you're eating, morning, evening. What matters is that you are fasting for a certain number of hours and that you are eating for a certain number of hours. And that's it. The only other thing that matters is that you are staying in a caloric deficit. It's not going to help if I spend 20 hours not eating and then I go down to the fast food place and get me a couple of burgers because I have fasted all day long. I used to make that mistake. I just used to eat whatever. When I came out of my fasting, I'm thinking, wow, my body is still here. The weight's not going anywhere. No, you want to stay on a healthy meal plan. It's most important to stay on that healthy meal plan. When you come out of your fast, imagine your body has now depleted itself of all the energy that you have consumed. You want to put in some good quality food into your body. All right, the next question that I typically get is, and I had this problem, coming out of my fast. I'm going to talk about just a few problems that you may experience during intermittent fasting. The first one is just barely discomfort. I'll come out of a 16-hour fast and I'll sit down and eat my first meal and my stomach just hurts. It cramps on and on and on. I'm thinking, what is going on? And then I figured out I needed to break my fast with some gentle foods. So generally, if I'm coming out of a fast 16 hours or longer, then I'll eat something like a plain non-fat Greek yogurt, or I'll drink some bone broth, just something to ease into my meal slowly, but not put that first heavy meal on. I mean, I won't sit down and eat, say, chicken and a salad when I am coming out of a long fast. So that's one thing. If you experience that cramping, start slow. So eat something small and then eat your main meal after the next hour. All right. The next thing that I used to have is I'll be walking around, especially when I just started fasting, after the first, I don't know, day number 1, day number 2, I mean, the food is in my brain. I'm thinking of food. I need to eat. I'm hungry. I used to get so hungry. I used to be grouchy. That's called hangriness. I mean, you're just hungry, really. So I started doing a few things. I realized that some of that hunger really was thirst. I'll question myself, did I eat enough the last time? Because sometimes we may be fasting and we're not conscientious enough to truly consume all the calories that we need. So you just get to where your body is deficient, you get lethargic, you get hungry all the time. So start looking into exactly how much you're eating and consume enough water. The next problem that I had with intermittent fasting was just a slight headache. After a few days, 2-3 days, really, I mean, the first 2-3 days, you expect them to be the most difficult because your body doesn't know what's going on and it says, wow, something is happening to me, so it starts talking to you in the negative way. All right, you want to maintain some mental focus there and just remember, the first 2 to 3 days could be a little bit tough, so you're tougher than tough. You're going to tough it out, drink lots of water and persist. Listen, your body is so trainable. You can train your mind, to do what you want it to. You can train your body to do what you want it to. So persist during those first 2 days, and remember, you're gonna get hungry, you're gonna get a little headache. Headache could be a sign of dehydration, not enough water. All right, the next problem that I also had was just constipation. Things just slowed down in my bowels. I was getting the belly bloat and thinking, what's going on with me? I'm trying to just be healthy and lose some weight. All right, so I noticed that my vegetable consumption was deficient. Why is that? Honestly, when you do fasting or you start fasting and you do it for some time, some things happen that change in your body. You don't get hungry as much. And the next thing that happens is that you start to eat less and less and less because your stomach shrinks. And so I automatically started cutting back on my vegetables. My bowels go down. I'm so sorry, my puppies are getting excited over somebody who's coming in the house. But anyway, I started increasing my vegetable consumption, and sometimes I couldn't even do that because my stomach has shrunk, and so I started taking probiotics. Probiotics have become a mainstay of my existence. It just helps me with belly bloat, it helps keep me regular, and it just really you know, if your bowels are not working well, and then you can change things. So add a probiotic, or you can also add a fiber supplement if you want. And I think that's all I have to share when it comes to intermittent fasting. If you have any questions, go ahead and type that in the chat. I'll be happy to answer your questions. But please, especially for those of you women in menopause, please consider intermittent fasting. One of the great benefits of intermittent fasting is that we don't think about, apart from weight loss, is just cellular rejuvenation. During that time that you're not eating, your body says, hey, wait a minute, all these cells that have trashy things, trashy proteins that just don't look right, your body starts to also trash them out, throw them out, and recover new ones. So your skin starts to shine, you start to have that much energy. So intermittent fasting really helps with that process. Now you're going to have to be fasting for the longer hours to reap that benefit. So 16 hours and above for several days, and then your body recovers itself. Intermittent fasting, again, not only helps with weight loss, it can help with mental clarity. You know, consumption of food all the time, snacking, eating too many carbs, they just cause us to have this brain fog. I'm just sitting and I can't think. So when you fast, studies have proven that intermittent fasting just helps your neurologic function, and you develop brain clarity. Your thinking becomes clearer. You do have much more energy. You feel great. Your skin is shiny, and you're losing weight. All right. Again, I hope I've convinced you. If intermittent fasting is safe for you, as says your medical care provider, if they say it is safe for you, please try it. It could be that little key that opens up the lock and helps you continue to lose weight in a safe manner. Let me know where you're chatting from. If you're not following me on Instagram, go ahead and hit that follow button. Follow me now. Tag your friends so they can benefit from the information that I bring to you almost every single day. This video will also be up on YouTube, so go to YouTube and follow me. All right, lastly, if you have not joined my boot camp, what are you waiting for? It's just $1 per day. Go ahead to my profile on Instagram and sign up, because I spend 5-6 days a week with my boot campers. I share with them my workouts, which are all knee friendly for women my age, and I give them information, and it's a great community to belong to if you're trying to lose weight. All right, ladies and gentlemen, thank you, and I hope you have a fantastic rest of the day. Thank you. Bye. Let's see if I can